In the previous video, we talked about how the heart can change its stroke volume and heart rate to best maintain a sufficient cardiac output. Today, we are going to look at the roles of the autonomic nervous system and the role it plays. The autonomic nervous system is responsible for all the unconscious, involuntary reactions we have to things. It controls our cardiovascular system, our reflexes, our breathing, basically all the things necessary to maintain homeostasis. The autonomic nervous system has two subdivisions, the sympathetic nervous system and the parasympathetic nervous system. In simplistic terms, the sympathetic nervous system is involved with reactions associated with the fight or flight response, increased heart rate, increased breathing, mobilization of energy stores, that kind of thing. Conversely, the parasympathetic nervous system is involved with the rest and digest responses, such as decreased heart rate, repair of proteins, digestion, etc., etc. In relation to the cardiovascular system, the autonomic nervous system has power over the following things: inotropy, heart rate, peripheral resistance, and fluid status or blood volume. In this video, I'm going to focus on inotropy and heart rate, and make a separate video focusing on vasculature and the autonomic control of vessels. The fibers of the sympathetic nervous system arise in the upper thoracic segments of the spinal cord. They travel by a mixture of small nerves to the heart via the adventitia of the great vessels. They act via adrenergic receptors which use noradrenaline as a neurotransmitter. There are various kinds of sympathetic adrenoreceptors, including the alpha-1A, which controls prostate and vascular smooth muscle contraction, alpha-1B, which controls vascular smooth muscle contraction, alpha-2A, B, and C, all of which control inhibition of noradrenaline and insulin release around receptors, the beta-1, which increases heart rate and contractility of myocardium, and the beta-2, which causes blood vessel vasodilation, bronchodilation, and renin release from the kidney. Now, some of the more observant ones amongst you might have noticed that alpha-1 receptors cause vasoconstriction, while beta-2 receptors cause vasodilation, but both are associated with sympathetic stimulation. This is an apparent contradiction, but it makes sense when you think about it. During sympathetic nervous system activation, you want to divert blood away from places where it's not needed so much, like the GI tract, and divert it towards places where it is needed, like the heart, the muscles, the brain, and the skin. So being able to simultaneously vasoconstrict the vascular beds around the organs we don't need to supply so much, and vasodilate around the organs we do want to supply more, allows us to redirect flow to where it's needed and is in fact beneficial. Having different kinds of receptors is what allows us to do this. In comparison to the sympathetic nervous system, the parasympathetic nervous system is mostly affected through the vagus nerve, also known as cranial nerve 10. It acts through muscarinic receptors that use acetylcholine as a neurotransmitter. It has a very strong effect on slowing heart rate, and can also decrease atrial inotropy, but doesn't affect the ventricles so much. On its own, vagal stimulation of the sinoatrial node can be so intense that it's sufficient to knock out nodal rhythm in the heart, forcing the atrioventricular node to take over. Without any autonomic involvement, the heart would beat at around 105 beats per minute. The fact that in most people the resting heart rate is about 70 beats per minute shows that vagal stimulation is pretty important for maintaining a normal heart rate. The sympathetic nervous system has a lag of about 1 to 3 seconds between receiving the stimulation and the effects of it becoming evident in the heart. It also requires as much as 30 seconds for maximum effect to be exerted and to maintain a steady state. Why does this happen? Well, if you remember the previous video, I mentioned how inotropy in the heart is all about calcium. Elevated calcium results in elevated inotropy. Well, the sympathetic nervous system works through beta-1 receptors to activate a stimulatory G-protein coupled receptor that causes upregulated protein phosphorylation and activation of a cyclic AMP-based second messenger system. As a consequence, we get increased L-type calcium channel opening, leading to a calcium influx, where it can then bind troponin C, activating it, and allow cross-bridge cycling to occur. However, this process is quite slow. The L-type calcium channels are called slow leak channels for a reason. Conversely, the parasympathetic nervous system can exert its effects to rapidly decrease heart rate much faster than the sympathetic nervous system can. The parasympathetic nervous system is also rapidly reversible if it needs to be, due to a very high concentration of cholinesterase enzymes in the myocardium to break down the acetylcholine neurotransmitter used, while the sympathetic nervous system's noradrenaline is slower onset, but also longer lasting due to the cyclic AMP-based second messenger system. Parasympathetic stimulation results in inhibition of the adenylate cyclase enzyme used to power the cyclic AMP-based second messenger system. This counters the effects of the sympathetic nervous system. Parasympathetic stimulation also causes decreased activity of the potassium pumps, reducing the intracellular potassium concentration. This causes repolarization to take longer, leading to increased action potential duration and therefore slower heart rate. As a gross generalization, sympathetic stimulation has greater effects on inotropy, while parasympathetic stimulation has greater effects on heart rate. So, we know the autonomic nervous system has some sway over how the heart works, but how does it know when to act? Surely it needs some way to measure what's going on to allow it to respond accordingly. Turns out, it does, and has 4 types of receptor in the body used to provide feedback about cardiovascular function to the autonomic nervous system. These are the systemic artery baroreceptors, the cardiac receptors, the osmoreceptors, and the chemoreceptors. Let's take a look at them in a little bit more detail. Systemic artery baroreceptors are found in the aortic arch and the carotid sinus. They feature both myelinated and non-myelinated fibers. They detect pressure by increasing their firing rate if they are stretched. The greater the pressure in those vessels, the greater the stretch, and thus the greater the firing rate. Firing rate will start at around 30 to 50 millimeters of mercury of pressure, and will saturate out at around approximately 180 millimeters of mercury. These sensors are slow adapting, so will reset to accommodate a higher average pressure if that pressure is maintained for a prolonged period of time. Decreased firing of these receptors results in increased sympathetic nervous stimulation and thus increased blood pressure. The second type of receptor is the cardiac receptor. These are myelinated vagal receptors in the subendocardial tissue near the veno-atrial junctions. These detect filling of atrial chambers and thus are a good detector of volume stasis of the body. The third receptor is the osmoreceptor. These are found in the supraoptic and paraventricular nuclei of the hypothalamus in the brain, and they sense changes in plasma volume and osmolarity, releasing hormones to respond accordingly. Our fourth type of receptor is the chemoreceptor. These are found in the aortic and carotid bodies next to the systemic artery baroreceptors and respond most strongly to the arterial pressure of carbon dioxide. They also respond to a lesser extent to the arterial pressure of oxygen and will trigger increased respiration if hypercapnia or hypoxia are detected past a certain threshold. That concludes today's video on autonomic regulation of the cardiovascular system. In the next video, we'll look a bit more at the vascular system aspect of the cardiovascular system, all the blood vessels and how they interact, and their role for maintaining cardiovascular homeostasis. And until next time, thank you for watching.